Teenagers, adolescents, they have a developmental milestone, and it's to form a sense of self, to form an identity.
Kids may have a tendency to build a lot of their identity around themselves as an athlete.
There's so few things that kids have control over, and sports is really the first place that they could say, I have control over how much I practice. I have control over relating to my teammates. I have control over setting goals and then adjusting them to make them realistic.
Team sports are one of the best ways to help kids kind of navigate that dual nature of being a person, to both be individuals and fit in and be accepted. So I think that is there for anybody in high school, but I think it's probably highlighted more for those student athletes that are trying to compete and be part of a team.
It's easy to neglect mental health in sports. Sports are not just about fun and recreation, it's about an opportunity to get out of a hardship. It's about being able to go to college for many of these kids. So a bad game isn't just a bad game, it's potentially going to impact their future negatively. So to be able to support that and keep that into perspective, that's challenging.
Some of those pressures start to, become too much, become burdensome, become something that hinders their progress in the classroom, on the playing fields, just in life in general.
With the exposure through social media of high school sports, everything has become so much more competitive. They are thinking that their performance is under a microscope and highly scrutinized, and people are paying attention to every move they make on the field, the court, the pitch, what have you.
If you're an athlete and you're not making the reels, the comparison can be devastating.
You're losing sight of what you're actually doing, which is playing a sport because you enjoy it. And instead it becomes something with a level of burden and pressure that you didn't necessarily sign up for. And when we get things that we don't anticipate or expect, it's the most likely time that we are emotional, irrational, and impulsive decision makers. It's not fair to expect a teenager to have the foresight to think of how their decisions today can impact their tomorrow. The brain hasn't developed enough to do that effectively or consistently.
The brain can only take in so much criticism, so much blame before it starts internalizing. And all it hears is, I am bad. I am not good enough. So, of course, many coaches don't intend to send that message, but if we're educated on how to balance criticism and praise and to let them know exactly what needs to happen, that's something that is fruitful for most of our people that work with our students, our athletes. And hopefully, every athlete understands, like, hey, there's bigger things. Take a break. This isn't going to define you. Quit if you have to. So I think those are options that if you're in it, if your perception is distorted and you're in a state of not good enough, it's hard to access those options.
If you have a kid who is on the playing field and they seem withdrawn and they seem really sad and they seem that they're not having any fun out there, they don't seem very motivated. Of course you could say, well, this kid's just not into the sport. Maybe, but maybe there's something else going on.
Ideally, coaches, teachers, parents, but also other peers are able to see, hey, let's look into this.
I think the healthiest approach is, communicating to kids, I'm concerned about your mental health because I'm concerned about you as a person first and foremost.
Even if your child says that everything's okay, nothing's bothering them, it's still so important that you are paying close attention so that you can gather more information, more evidence, so that if you are going to confront them, you are going to tell them it seems like something's off, you're able to present them also with the reasoning and the evidence behind it. It's also important that when you're trying to reach one of them or connect with one of them, that you're doing it with grace and you're doing it with empathy and you're recognizing, okay, what is it that they can help? What is it that they can't help? And that also is likely to resonate with them.
And then talk to a professional. Make the referral. Start out, if it happens at school, go to your school counselor. Your school counselor is going to know who are the local providers.
Most teenagers, aren't in love with the idea of coming in for talk therapy. Yet at the same time, it may be a really good idea.
We have to be able to talk about the hard things. There are kids taking their lives because they perceive that there are no other options. So to be able to, as adults, have hard conversations, making sure that they know their local crisis center, making sure they know what the National Suicide Hotline is, 988. Because there's no way to identify which kid is capable of doing it. They're all over the map. So checking in, hey, how you doing? All right, are you having thoughts of ending your life? And that's an important thing to be able to step in and do. The pressure of being a student and an athlete, unfortunately, a lot of kids took the wrong way out.
It's not a parent, teacher's, or coach's job to know what to do. That's why I had to go through so many years of schooling and training to know what to do. Those people, their job is just to recognize and connect to treatment, which speaks to the importance of Inspira serving our communities and offering the access to quality behavioral health care.
Behavioral health is going to help student athletes establish a healthy foundation on which they can build anything. They can start to question their own expectations of, what am I doing here as a soccer player or a basketball player? What are my expectations? Why am I playing?
Kids are our community. Think about what they do for us. They bring us together. To be able to just see and interact and support and nurture them so they're building competence, genuinely, authentically becoming who they are, that's the most rewarding thing a community could do.